Hi, Dr. Emily Kirby here. I get asked all the time, can you remove stretch marks? Yes and no. So it's important to think about if you are looking for a surgical correction or a non-surgical correction. So first, let's talk about what stretch marks are. When you have stretch marks that might be from pregnancy or rapid weight gain, or you can even get it from some steroids or illnesses and things like that. When you have rapid weight gain and your tissue stretches, if it stretches beyond the capacity of your skin to stretch that quickly, then you might get a stretch mark. We also call them stria in plastic surgery. So the outer layer of the skin is called the epidermis, and then you have the dermis underneath that. When the skin stretches, what can happen is that you can split the dermis underneath here. And if that happens, that the dermis is split, then you might see through that epidermis and see that split underneath. That is the stretch mark. So it's truly a scar because that skin has actually split. And once you have a scar that affects that dermis, that scar is not going to go away. So there are things that we can do to improve the appearance of stretch marks or improve the color of the stretch marks, but no one should ever be able to promise you non-surgically that they can remove your stretch marks. That cannot happen. If you have a very pink discoloration of the stretch mark, it might be a newer stretch mark or a purple discoloration. Usually those are newer stretch marks, or they could be permanently discolored. We have lasers that focus on that specific color, and they can help to fade the color of that stretch mark. The other thing that might happen is even if the stretch mark is flesh colored, faded back to your normal skin color, you might notice that texture irregularity or that contour irregularity. If that's the case, something like microneedling is going to help smooth that contour out. And again, it won't remove it, but it can help improve the appearance of the stretch mark. So microneedling is a device. We use skin pen, we also use Morpheus, and microneedling allows tiny little needles to create micro injuries into the skin at a very specific depth. And when it does that, it initiates our body's healing response. And it's that healing response that brings in that very youthful remodeling of that tissue. And by youthful remodeling, it brings in collagen, it lines up collagen, it brings in all of these healing cells that allow that tissue to turn over and remodel and become a different appearing scar. So again, the scar would still be there, but maybe an improved appearance as far as the texture and the contour goes. So adding to that with skin pen, you can add PRP. PRP is platelet-rich plasma. We draw blood from you, put it in a centrifuge that spins it down and allows that to separate. And then we draw off the beautiful PRP. It's rich in platelets, and we use that on the surface of what we have just created, those little tiny micro injuries. And that it's almost like a turbo effect for whatever treatment that you're doing. And so it can really help even more remodel that scar remodeling process. When we do Morpheus, you get the microneedling, but added to that is radiofrequency. Radiofrequency is a heat, and what the heat does is it allows the delivery at a very specific depth of the heat that also adds a little shrinkage and a little tightening to that tissue. So you're remodeling with the microneedling and with the heat. So those are two options that are good. Now, when I said yes, you can get rid of stretch marks, that's because surgically, for example, with a tummy tuck, if you have stretch marks on your abdomen, say from pregnancy, if the tissue in the area that happens to be removed with a tummy tuck has stretch marks, they will be permanently removed. So in that way, yes, previously, no. Does that help?